Introduction. Insulin is a vital hormone produced by the pancreas to help regulate blood sugar levels. In children with type 1 diabetes, the pancreas no longer produces insulin, making it essential to administer it through injections or an insulin pump. This video will guide you through the process of giving insulin injections to babies and young children, and how to support them as they gradually learn to inject themselves. Why insulin injections are important for children. Children with type 1 diabetes rely on insulin therapy to manage their blood glucose levels and prevent complications. While insulin can be delivered in different ways, injections remain one of the most common and reliable methods, especially in younger children or those not using an insulin pump. Giving insulin injections to your child. When your child is first diagnosed, injections are typically administered by a parent or caregiver. Many children start by observing how it's done. Some may feel comfortable taking on the responsibility quickly, while others need more time. Either path is completely normal. It's important to approach insulin injections with calmness and consistency. Establish a routine that helps your child feel safe and informed. Use age-appropriate explanations to help them understand why the injection is necessary and what to expect. Encouraging independence over time. There is no set age when a child should start injecting insulin on their own. Readiness varies greatly. Some children feel confident early on and want to try self-injecting soon after diagnosis. Others may need more time to become familiar and comfortable with the process. Support your child by following their lead. When they express interest or readiness, encourage their independence with patience and positivity. You can help them gain confidence by watching educational videos together, reviewing simple instructions, and being present for reassurance during early attempts. Practical tips for success. Choose injection sites together to give your child a sense of control. Rotate injection sites regularly to avoid skin irritation. Use distraction techniques or relaxation strategies to reduce anxiety. Acknowledge and praise efforts, even small ones, to build confidence. Stay consistent with routines to promote a sense of security. Helping your child learn to manage their insulin injections is a gradual process that combines medical care with emotional support. Whether you're administering the injections yourself or guiding your child through their first attempts, remember that confidence and independence come with time and practice. With the right tools and encouragement, children can learn to manage their insulin needs with resilience and confidence. Understanding your insulin kit. Before beginning insulin injections, it's essential to be familiar with the tools you'll be using. Here's what a standard insulin kit includes. Insulin pen. There are two types. A disposable pen comes pre-filled and ready to use. A reusable pen requires you to insert an insulin cartridge before use. Insulin needle. This needle is small and fine, designed to deliver insulin just beneath the skin, not into a vein or muscle, making the injection process more comfortable. Needle clipper or sharp spin. These are used to safely dispose of needles after each injection. Both options are available free of charge with a prescription, which a parent or guardian can obtain from a healthcare provider or pharmacy. How to inject insulin. A simple, safe procedure for children. Administering insulin is a manageable process when approached step by step. Below is a clear guide to help children and their caregivers perform injections safely and effectively. Step 1. Wash your hands. Begin by washing and thoroughly drying your hands. This helps prevent infection and ensures a clean environment for the injection. Step 2. Choose the injection site. Select an appropriate area with fatty tissue such as the abdomen, thighs, or buttocks. To maintain skin health and ensure effective insulin absorption, always rotate injection sites. Choose a location at least 1 centimeter or half an inch away from the previous site to avoid developing hard lumps, known as lipohypertrophy, which can interfere with insulin effectiveness. Step 3. Prime the insulin pen. Priming ensures that any air in the needle is expelled before injection. Attach a new needle to your pen. Remove both caps. Dial up 2 units of insulin. Hold the pen upright and press the plunger until insulin appears at the tip of the needle. Step 4. Prepare the injection. Clean the selected area if needed and ensure it is dry. Dial the prescribed dose. Insert the needle at a 90-degree angle into the skin. Press the plunger until the dial returns to 0. Step 5. Wait before removing the needle. Count slowly to 10. This gives the insulin time to fully enter the body and helps avoid leakage from the injection site. Step 6. Dispose of the needle safely. Use a needle clipper or sharps bin to discard the used needle. When the sharps container is full, your parent or guardian can follow the correct procedure to dispose of it safely. Understanding insulin pens. Children with type 1 diabetes typically require insulin multiple times per day. In most cases, insulin is administered using an insulin pen, usually 4 or more times daily. These pens are designed for ease of use, precision, and convenience. For many children and their families, the first few injections can feel stressful or uncomfortable. It's natural to feel anxious in the beginning. However, as your child becomes more familiar with the process and gains confidence, insulin injections tend to become easier and less distressing over time. Insulin pumps as an alternative. While insulin pens are commonly used, they are not the only option. Some children and teenagers may prefer using an insulin pump. This small, wearable device delivers continuous doses of rapid-acting insulin throughout the day and night. It can also be adjusted to deliver additional insulin when needed, such as at mealtimes or during periods of high blood glucose. If your child is interested in using an insulin pump, speak with your healthcare provider. There are specific medical guidelines that determine who is eligible, and your care team can help assess whether a pump is the right option. It's worth noting that while pumps can offer more flexibility, some children may prefer pens, as wearing a device full-time may feel restrictive or burdensome. How to support your child with insulin injections. Your role as a parent or caregiver is essential in helping your child manage their diabetes with confidence. Here are key strategies to support them through their insulin journey. Be patient and supportive. Allow your child to take the lead when they're ready. Do not pressure them to inject themselves before they feel prepared. Encourage independence. If your child expresses interest in doing their own injections, support them in taking ownership. Avoid stepping in unless they ask for help. Offer flexibility. Even when your child is capable of injecting on their own, they may occasionally ask you to take over. Be available and understanding. Monitor technique. Gently observe how your child administers insulin to ensure proper technique. This helps prevent the development of ineffective or unsafe habits. Time injection sites carefully. Avoid injecting insulin into a site that will be used immediately for physical activity. For instance, avoid injecting into the leg right before a football match, as this can accelerate insulin absorption and increase the risk of hypoglycemia. Whether your child uses an insulin pen or pump, the key is to find a method that fits their lifestyle and comfort level. With the right guidance, encouragement, and routine, children can manage their insulin needs effectively and with growing independence.